So my name is Madeline Hills. I've been a pharmacist in community for 8 years, working in different places across Australia, and I think I've worked in about 30 pharmacies. I think the primary conversation around hepatitis has always been about prevention and vaccinations, particularly with people who are travelling overseas or with children, obviously, again, the vaccination schedule. And I think, that conversation is quite frequent. Treatment of hepatitis B and C, I think, is far less frequent in community pharmacy. I think most pharmacists do talk to patients about other health conditions when they present with one medical issue. But I think in a large part, hepatitis is not something that's discussed. And I'm not really sure why that is, whether it is about stigma or it's about being hesitant to make assumptions about a person's history. But I think definitely asking somebody whether they know their hepatitis status would be beneficial and certainly help with their overall management. I think there's definitely more scope to talk with patients about treatment now that the medication is available in community pharmacy. It just is now a starting point for the conversation and an opportunity to talk with people about how to manage their medication and also their health so that they get optimal treatment with their hepatitis. I think depending on the environment, it can be really difficult to discuss sensitive matters in the community pharmacy. Sometimes it's really busy, there's other customers there, there's other staff members there, and you don't have the opportunity to really talk to somebody about their issues. Most pharmacies should have a private area that they can access, and this is a great example of when that should be used. It allows both the pharmacist and the patient to have a discussion and ask questions that perhaps they might not be so comfortable, out in the store, in a busy store. I definitely think pharmacists could benefit from training about stigma and discrimination surrounding hepatitis. I think one of the most important things to realise is that not all patients will have a history of injectable drug use. While some patients may, there's so many other ways that people can acquire hepatitis. Whether it's through tattooing, piercing, medical procedures overseas, even transfer from mother to child in birth, and it's naive to make any assumptions about that. HEPReady empowers pharmacists to talk to their patients about hepatitis.